Whenever I talk about Ayurveda, I have two tendencies in my mind. The first is that Ayurveda is so rich, has such an amazing amount of valuable information to help the suffering of people, that I want to talk very fast. So everything is included, so you don't leave anything out. And again, Ayurveda is so deep, has such a deep meaning, that I want to talk very slowly, so that each word drips in your brain and the importance of each word really stays with you. So as my teacher and friend Vaidhyasvin Bharot says, I'll try to do madhyama, talk in between. So fast for the richness of Ayurveda and slowly so it gets into your mind. My good friends, I want to offer as well my greetings to the Honorable Minister, to Dr. Anup Thakkar, that many times I have met him in Jamnagar University, and I'm happy to see his progress and thank him for his kind words. I want to thank Dr. Sudhir Shah, who is an eminent neuroscientist, and he is together with us to give his insight in Ayurveda. Foremost, I would like to thank Vaidhyasvin Bharot for this amazing journey that I'll talk about it in a few minutes, that started in 1989 and carries on up to now, and he helps me with this unbelievable journey through Ayurveda. And I want to leave out the 4 Vaidyas in the Global Agnikarma Center that through their dedication and through their hard work have helped so many patients who are suffering from chronic pain. I will not leave out our good friend Dr. Camillus Power from Ireland, who has an amazing academic career, the first Dean of Faculty of Pain, and he always puts energy with his smiling and kind personality and really gives us more and more science, and you'll listen from him a little later. So thank you to everyone, and let me start this little journey in Ayurveda. We are talking about really pain management and Agnikarma. Why pain? Look, if there was no pain, there would be no need for physicians. It is pain that really takes us to a physician, and really sometimes in the West I can say it is more emotional pain, because the West has a lot of materials, and in the East, as I have seen, it is both physical and emotional pain. So thermal microcautery or Agnikarma is a method that I have been amazed to see how it can work with pain. But Agnikarma means the action of Agni, and I will not say too many words about it because you'll see the action of it by the Vaidyas who are working in the Global Agnikarma Center. However, I'll take you through my journey to Ayurveda, and this is how it started. This is the magic of Ayurveda. You can see us here with Vaidhyasvin Bharot. I met him many years ago when I was still a student in the university, and it was in 1989 I went to England, and really I asked him to teach me Ayurveda in a spark of insight in our brain, in my brain. And really, what can I say? They say that for a real teacher, there are 2 things. One is to take away from the illusion of the superficial world, and the other is to drag you in the depth of the inner self. And I have never seen a person like him who combines philosophy and science. He is my joy to be with him, and I want to thank him again for being here for all of us. So this is the magic of Ayurveda. And here is the Holistic Health Center in Athens in Greece. It's a beautiful house in the countryside, really a medical center should be in nature, because it's nature through the 5 elements that helps us to heal patients. It's nature that gives us knowledge and gives us herbs. And you can see it has a nice garden. This is summertime with a lot of trees, and this is where I'm working and seeing patients in Greece. I came here in Greece in 1999 after being for about 10 years working in Halle Street in London. And Greece in some way combines this peculiar deep knowledge of East, like India, and the organization of the West. It's in between. So we thought that a center in Greece can combine both East and West and have this integrated approach in this way. And here, for people who don't know us, we give seminars, we spread the principles of Ayurveda. This was, of course, a pre-COVID state when we could all meet, and we talk about the philosophy and the medical aspect of Ayurveda, not only here in the Holistic Health Center, but we are invited, I'm invited to many other areas. This is the Open University in Athens. I was invited to give a lecture about Ayurveda because there was a great interest in this science. So in some way, I know we call it Global Agnikarma Center in India. I will say the globalization of Ayurveda simply happens through the amazing knowledge that is included in Charaka Samhita, Sushrut Samhita, Vagbhata, and it is like the sun. The sun is globalized because it's very useful. Simply we have to polish ourselves as physicians, go to the depth of it, follow the slokas, then Ayurveda can be really all around the world. And you all know these 3 simple terms called Vata, Pitta and Kapha. And in some way, when I first came across these 3, let's say, terms, I thought it's very intelligent because I was doing research in asthma and I was looking totally modern concepts of medicine, but I had this, let's say, inspiration that Vata, Pitta and Kapha are not simple Sanskrit words. They describe in a much more dynamic way what is happening in the human system. In modern medicine, the knowledge of health is mostly limited to either chemicals, we do a blood test and we measure all the chemicals, or it is in some way limited in modern technology, all the CT scans, MRI scans, or in biopsies. This is how we define health. And I thought that this is a nice analytical way, but very static. And this is where Ayurveda really enlightened me in deciphering, in opening up this mystery of health. Movement, Vata, metabolism, really all the chemical reactions in our system, and stability, homeostasis, were the first words that came to my mind where I encountered these words, and I thought that's very, very wise. But to be very honest, I never believed the depth of these terms. And let me take you to this journey. You might not know, but in some way, recently, we know that if Vata is a Deha Prakruti term, and this is what we say in India, is a Deha, defines the Deha Prakruti, the physical Prakruti, there has to be a physical structure that in some way mediates Vata. And really, in this year, they found what they call the piezo 1 and 2 receptors, and you can see in the screen that when you press the skin, this receptor opens, and then electricity is transmitted in the system. So if you think of Vata, don't think of anything ancient. Don't think of anything that is just philosophical. It initiates things. My brain this minute sends signals to my heart and my heart beats. My brain sends signals to the lungs and the lungs breathe in and out. And this piezo 1, this sense of touch that in Ayurveda in the beginning we say each element is connected with a sense, and we say Vayu is connected with Sparsa, it looks in some way simplistic. But remember, it's not simply the touch of two hands, as you can see here in the picture. It's the touch of every cell with every other cell through receptors. So touch means that the blood touches my arteries, and as it touches the arteries, it gives information to the heart how the heart should beat. It touches the kidneys and it gives information how much renin should come out so I can have a normal blood pressure. So please, whoever studies Ayurveda, all the students in India, remember Vata is a very, very deep concept. And recently we found these receptors that initiate Vata in the body. And if I leave Vata and go to the next, Pitta again is metabolism. We all just this minute have a temperature in our body, and this temperature allows us to be alive. And we're talking about Agnikarma, and we were thinking, what is the receptor that really transmits this heat? And remember, whoever has applied Agnikarma, we press the skin, we find the painful points on the skin in a very precise way, in some way using the piezo 1 and 2 receptors, and then we burn exactly this area with an amazing precision. I really tell people that to do Agnikarma properly is like opening a door with a key. You have to really put the key very precisely in the keyhole, otherwise Agnikarma will not work. And here we have, as you can see, the fire that can be absolutely creative. We get warm, we are alive, we cook, we eat, or can be absolutely destructive. We burn. And really, these are the receptors, TRPV1 that gives us a sense that there is heat around, and TRPM8 that gives a sense that things are cold. So again, Pitta is not a simple thing. It's all the interaction between all the molecules in our body that allows us this minute to be alive. It's the interaction in my brain that reminds me English, reminds me Ayurvedic terms, reminds me who I am, who you are, and this is what initiates and transforms this second and creates a speech. This is the magic of Pitta. And if we go to Kapha, again, please don't think that Kapha is just phlegm or lungs or just, a slimy thing. Kapha is stability. This is how we start, like a fetus in the womb of our mother. And this is the DNA that really has all the information to create a fetus, to create me that I'm talking just now. So the structure of my hands, the structure of my vocal cords, the structure of my tongue is incorporated knowledge, is incorporated information that manifests as Kapha. And not only has created a structure and a form that is just now is seen on the screen, moving his hands and talking, but has a system of memory in it through the DNA, has a system that can repair my body if something goes wrong. If we have a wound in our hands, straight away platelets come out, the blood creates a clot, and there is a scar and we heal. So I really want to transmit my enthusiasm about the science that Vata, Pitta and Kapha are not just ancient words in the British Museum. They are unbelievably dynamic terms describing health as it is. And if you think this is the only thing, look at this. There is, in the West, there is something called the Nobel Prize. And I'll read this, that this is in Sweden. The Nobel Prize of Physiology Medicine went to these two doctors, David Julius and Ardem Pataputian, because they discovered the receptors for temperature and touch. Can you imagine? Ayurveda talks about senses and heat and sparsam and Agni thousands of years ago. And it is just now that we open, we encode, we find the significance of these receptors. And you know, it's not a simple thing. I have put even in Indian money that each Nobel Prize comes with 9 million Swedish krona, which is 7 crore rupees and 25 lakhs rupees in this way. So these people just in 2021 got the Nobel Prize for rediscovering these receptors. And in the gold coin is Alfred Nobel, for whose, let's say, honor this prize is shared. And here these two people, you can see David Julius on the left hand side and Padaputian in the right hand side. Now I have a surprise for you. This is David Julius, and you'll be very, I hope, surprised, happy and enthusiastic to hear that he knows about Agnikarma. Please show me your enthusiasm by shaking your hands or anything like this. How does he know about Agnikarma? He knows because on Tuesday the 18th of January, Dr. Camillus Power and myself had a Zoom meeting with him, and we discussed about the mysteries of Agnikarma and how the signals we give on the skin can go to the brain and can change the pain. And I have to say, I admire Dr. Power because his name is Power, and he has written an amazing letter a few days later to really put a little more Pitta in Dr. Julius, so we can all together do something and really decipher this mystery of Agnikarma and how it is working. So can you ever imagine that Ayurveda has been in the mouth and the words of someone who got the Nobel Prize and Agnikarma? I'm telling you again, Ayurveda is a diamond. You have to have a very good jewelry man, and I think Ashwin Bharot is the best to help you polish your system so Ayurveda can be bright all over the world. And let me go to a little more science. In modern science we say there are 3 really drugs in the world. One is morphine, the other is penicillin, and the third is steroids. Everything else is derivative of these really drugs. And chronic pain now is an epidemic. We all know why. Sedentary life. We thank God we live a long life, but really, what is life if you have a pain, if you cannot move? What is the point of being 60, 70, 80 if you don't have the freedom to move? And not only this, as you know, all the habits you have with nutrition, with a lot of stress, not doing yoga, I'm just encouraging everybody to do yoga as well, we have this type of chronic pains. In the hospitals, one of the great causes of mortality is the use of anti-inflammatory medication, because it creates bleeding in the stomach, bleeding in the GI tract, as we say, and a lot of people die because of this effect. But not only this, you might have heard that nowadays there is an epidemic of opioids, which is the other class of medication we use for pain control. And you can see that over the years, the deaths caused by overusing these medications going up and up and up. So if one says, why Agnikarma? Why Vaidyanathan Bharot got in his mind that this is very important? Why do we put energy in this? Not out of a fantasy or an illusion. We do this because there is a great practical need for people to be treated with some method that does not have side effects. And we all know in Ayurveda there is Panchkarma, there are herbs, ashwagandha and gotu kola and gututsi and ginger, and they really help in pain. But with this globalization that everybody needs now Tinospora cordifolia or gututsi or ginger, how many herbs are in India that can cure the whole world? It's impossible. So Vaidyanathan Bharot thought we need to have a method that is slightly independent of herbs, that can help people in a more, let's say, direct, fast way. And I heard Dr. Sudhisa talking about neuromodulation. He's absolutely right, of course. Think pain is a signal that the brain gives me and says there is a problem there. And if you give a chemical, the chemical is very gross. Yes, it will help with the pain, but it will have side effects. And we know that it happens. If you take aspirin or non-steroidal anti-inflammatory drugs, they can have an effect in thinning the blood, creating strokes, creating bleedings in the system. If you take opioids, as I said earlier, there are problems. So the modern tendency is neuromodulation. What does it mean, neuromodulation? It means you take the nervous system, this is the neuro part of the word, and you change it, you modulate it, you change the way it's working. And you can see someone holding something around his neck there that really gives signals to the vagus nerve, or put something on the forehead that gives signals to the trigeminal nerve. But think of something, and this is the beauty of Ayurveda. If you want to change the nervous system, what signals would you use? Magnetism, electricity, or heat? I will say heat is the best. Why is it the best? Because for millions of years, the paths in our nervous system that transmit the signals of pain and of heat were together, and they are together. Why? What was the first thing that was killing people 10 million years ago? Cold. Cold because there was not enough food, there was not enough energy. So it was very important for the body to sense the heat and the cold. What was the best, let's say, discovery? Was fire. Through fire you can get warm. Through fire you can cook. And if you cook something, automatically the nutritious value of the food becomes much bigger for the system. This is how civilization developed. So heat is a very, very deep instinct, is a very deep signal in the brain, and that's why I feel Agnikarma is great using this signal to modulate the pain. And yes, we have a lot of different methods for this, and you can see the traditional salak at the end that we have all used it. Dr. Power, myself, in the beginning, everybody in the Agnikarma Center. But well, Ayurveda says that knowledge is always developing. So you can see a nice machine there by the Global Agnikarma Center. You can see a machine I use in the Holistic Health Center, thermal microcautery machine that has a regulated temperature. So these are the ways to do Agnikarma. And this is simply, you can see here that heat through the capsaicin and pain are together in substance P is the pain substance. This is how the signals are transmitted, but I'll leave more science to Dr. Power, who's going to talk in a little while. And have a look here to see how we do Agnikarma in the holistic healthcare in Greece by applying this method.
6 again.
And there.
7.
And there.
8. 8.
And here. We ask the patient to describe the scale of pain. 8, and the other 3 are 6.
Yes.
We apply this herbal cream to relieve any irritation on the skin. You can hear the crackling sound. This is described in Sushruta. When you do Agnikarma, there should be a sound.
It's not burning, it's not painful.
So we'll observe the next 48 hours and we'll be in touch. Okay, thank you. And here I'll show you a little more close-up Agnikarma procedure to see how it is done. Again, we ask in a very detailed way the patient. 9. And pain here. This is a patient with multiple sclerosis with a lot of pain that has gone extremely well through Agnikarma. 8. She's a professor in university.
8.5.
Okay. Here is the machine with all the lights indicating the temperature. You You just touch the skin is a signal that you give to the nervous system. This is the way you modulate and you really make the pain disappear.
After the green? Okay. One more point here. Breathe in and let it go.
You have different signs on the skin depending on the magnitude of pain they have, to be clear about it, to decide how many points you'll do.
And the last point, breathe in and let it go. All right.
So this is the practical application of Agnikarma. And integrated medicine, really, we have published with Dr. Camillus Power about thermal microcautery in the treatment of painful knee osteoarthritis. I know these are just words on the screen, but can you imagine that Agnikarma was used in a national health hospital in Ireland, in one of the teaching hospitals? Can you ever imagine Ayurveda being applied in such a practical way and being published? And when I say published, whoever does not know, to publish in the medical literature means you send all the information, it is reviewed by pain specialists. They decide it is reliable, and only then it is published and becomes a part of the public domain of the knowledge of doctors who can go there and look at it. So publishing is not like putting something in a magazine. It is a very serious scientific approach. And again, the application of thermal microcautery in migraine management. This work was done with Dr. Papageorgiou as well, who must be with us somewhere. I spoke to her today, and we have published this again in the headache medicine, how thermal microcautery can help in migraine. So integrated medicine, I think in some way was in the beginning when I had the very good luck and destiny to meet Ashwin Bharot, Vaidya Ashwin Bharot, and we decided someone who is an expert in Ayurveda, someone from a modern background, to put things together, to drop any ego it had, and we just discuss about any disease in a modern point of view, in an Ayurvedic point of view. And these are all the people who cooperated for the really the scientific word publication in this sense. And we have to acknowledge Vaidya Ashwin Bharot, plus all the doctors in the Global Agnikarma Center who have kept a strict protocol for every patient in India, in the Global Agnikarma Center. Dr. Power, myself, Ashwin Bharot have decided to have a protocol, so all this information is kept, so it can be helpful to other scientists if they want to really apply this method. And this is again the application of thermal microcautery in migraine. So I want to thank you again, to thank everybody, thank Vaidya Ashwin Bharot for his constant guidance. Namaste to everyone, my wishes for health, and thank you again for inviting me, and I'm happy to be a part of all this team. Hari Om.